been telling you for the past week about a major decision impacting more than 200,000 Arkansans' insurance plans. The federal government says the state's Medicaid expansion program will not continue next year. As we found out in a recent report from the Arkansas Advocate claims, it has the healthcare industry alarmed for what's next. I sat down with the Advocate's editor-in-chief, Andrew DeMillo, for a closer look at the options moving forward. So I wanted to start just with an overview of the Medicaid expansion program and talk about when the program started and just what the expansion part of all this means.
Yeah, Medicaid expansion was a key part of the Affordable Care Act, the federal health care overhaul, also known as Obamacare. Provision in it allowed states to expand the eligibility for Medicaid to 138% of the poverty level. The U.S. Supreme Court in 2012, however, said that it's up to states to decide whether or not to expand Medicaid. And Arkansas in 2013 was a state with a majority Republican legislature. Many members who had run against Obamacare and against opposition to President Barack Obama, and they came up with this hybrid plan to expand Medicaid, but using private insurance for the coverage.
In Arkansas's program, it's had a few different names over the years. Can you talk about where Our Home fits into that history?
Yeah, it's gone through at least three different names. It's been called the Private Option, Arkansas Works, and now our home. But it's all basically the same concept, and it was a really unique model. It was first in the nation, where instead of putting those eligible on Medicaid, what the program does is purchase private insurance plans for those who are eligible, also known as qualified health plans. Right now, Arkansas has more than 200,000 people on the Our Home program.
So what do you think have been some of the benefits the state has seen since they adopted the expansion model?
If you talk to health providers, talk to health experts, there have been a number of benefits. The two main ones have been that Arkansas has seen a cut in the number of uninsured people in the state because of this expanded coverage. And also for hospitals, it's also reduced the amount of what they're paying for what's called uncompensated care, which is basically paying for care for people who come in without health insurance. And so there's been a benefit both for individuals, but the healthcare system as a whole.
And kind of getting to the heart of your recent reporting and just the issue everyone's talking about right now, we know that Our Home program was set to expire at the end of the year. The state was looking to extend it. What have we heard so far on the decision at the federal level from CMS?
The interesting thing is, the word that we've heard so far has been from the governor's office and from state officials. CMS has, at this point, they still say the state's waiver, which is its request, is under review and have not really commented on it. So we have not seen the formal notification. But what we have heard from the state is that the request to extend it beyond this year has been denied. They're in discussions for some kind of temporary extension that would essentially be kind of a bridge for the state to toward next year's legislative session, for the state to come up with a solution and essentially come up with some kind of replacement plan for this. But in terms of kind of the details of it from CMS, that's one of the things we're still waiting on right now.
Yeah, so right now, nothing is set in stone, and it's also for the 200,000 people relying on the program. It's not that they're just going to be left in the dust.
No, and the Department of Human Services, one thing they've said is people who are on the program not right now, there's nothing that they need to do. They still have coverage right now. Just the uncertainty is what happens after December 31st. And I think that's the discussion right now, is what happens with this. There's already some discussions about what the solutions would be, what the alternatives would be. Two of the main things that we've heard right now, the two main options that are being discussed are putting these people who are on Our Home on what's known as basically Medicaid, fee-for-service Medicaid, or contracting with managed care organization. Either one of those pose their own logistical and political challenges. And so I think that's what we're kind of waiting to see what the discussion next year is going to be with it. One thing that we're hearing from health experts is they really the third option of just having 200,000 people without care would be disastrous for the state and for its healthcare system, which already has faces some pretty strong and significant financial challenges.
Yeah. Can you talk some about how this all relates to the One Big Beautiful Bill Act?
Yeah, this is related to the One Big Beautiful Bill Act. The explanation that we've heard from the governor's office in the state is it has to do with something called budget neutrality. And budget neutrality means when you get approval for a special program like this, you have to prove that it's not going to cost the federal government more than it would without the special program. There was guidance that was issued to the states after the One Big Beautiful Bill Act that really put some new restrictions on budget neutrality and may make it more difficult for states to be able to prove that a program like Our Home is budget neutral. And that's been kind of the sticking point right now, and the reason for this not being renewed.
Yeah. And obviously, the Arkansas Department of Human Services, you kind of touched on this, is the agency in charge of this at home. Can you talk a little bit more how they're responding to all this?
They're making it clear right now that right now things aren't changing for people on the program right now, and that there are discussions. The governor's office has said that they are in discussions with the Trump administration about some kind of a short-term extension, which would give the state time to kind of figure out what the alternative is, figure out what the rollout is. And a big part of it is also going to be figuring out what there's legislative support for. A big part of the history of Arkansas's hybrid expansion here has, it's been a big point of contention. We've seen some legislative sessions where it's taken multiple votes for it to pass. We've seen people Republicans targeted in primaries who have supported it. And so, I think anything that comes up next year, you've got the challenges with fee for service and with managed care, where you may get support for something like that, but you may lose some of the support you'd normally have for Our Home. And so I think that's going to be part of the calculus too, is not just the logistics of setting up something like this, but will it maintain that support that they'll need, not just to establish it, but to keep it going every year.
Mm-hmm. And in your reporting, when you've spoken to healthcare providers and advocates, you use the word alarm to describe how they're reacting to the decision. Can you talk a little bit about what you've heard from them so far?
Yeah, there's a major concern among healthcare providers, among experts here. Arkansas's healthcare system already faces some serious strains right now. We've seen hospitals have to cut back on services or partner with other facilities to deal with increased costs right now, as well as low reimbursements. So the thought of potentially a major change to this program, or even 200,000 people losing coverage, is kind of a shockwave for the system right now. Because one thing you have to remember is that people, if they lose the coverage, they're still going to get sick, they're still going to get injured, and they're still going to go to the hospital in many cases. And a lot of times, the hospitals may have to face even more uncompensated care costs, may have to eat these costs, and that's really the big concern about what does this mean for the healthcare system, and what does this mean for these hospitals that really are struggling right now to begin with.
Yeah, and talking about what we were talking about earlier, we have talked to state leaders who say Arkansas just really needs a plan going forward. And I know in your reporting, you've talked to the former state Medicaid director about some possibilities. Just from everything you've gathered and your own thoughts, your reporting, what do you think is the most probable option moving forward?
I'm definitely not one to be able to predict on it. I do think they face a lot of challenges next year in getting this through, or in finding a solution on this. The debate over Arkansas's Medicaid expansion. We've had legislative sessions where they've really been upended by some of the debates over this. And I think you've got that challenge again, but you've got a very different political environment. You've got even more polarization. And you have the Trump administration, which has been making cuts to Medicaid elsewhere. And I think all of that combined is going to make it, much more of a challenge than I think, and probably even more of a challenge than it was when the program was first adopted here in 2013.
A new development in all of this, DHS Secretary Janet Mann has now formally requested a 2-year extension for the Our Home program. DHS says CMS has signaled it will support efforts to ensure a smooth transition and looks forward to the productive discussions on the extension in the near future.